Welcome to Megaphone from Medvale Media. I'm Dave Self. Megaphone is where experts and interesting people share their thoughts, perspectives, and the occasional rant about the ever-expanding and dynamic world of healthcare. In this episode, we welcome Dave Jeppesen, an accomplished business and healthcare leader, and most recently, the director of the state of Idaho's Health and Welfare Department. Thanks for joining us, Dave.
Thanks for inviting me. I'm glad to be here.
It's great to see you. Let's start off with the Dave Jeppesen definition of public health in 2024.
Well, that's a broad question. Public health is really, in my mind, about those actions, those threats that we could have that can affect overall health of a community, and the actions that the community has to take to prevent or deal with those health issues. And that can range from everything from West Nile virus, from mosquitoes that happen here in Idaho, all the way up to, as we experienced early a couple of years ago, the pandemic that took place, as well as things like tobacco usage and things like that.
Are there misconceptions about public health?
I think that there are occasionally misconceptions about public health. I know before I started working in there, I certainly had a few myself. And probably the biggest misconception about public health is that there's something that's required. And really, most things in public health are done on in fact, all things are done on a voluntary basis. A big public health push is vaccinations, for example. And there's certainly some folks that believe that those are that the government's going to come force you to do that, and that's actually not the case. Now, obviously, it's good for everyone to get vaccinated, but that's, I think, the biggest misconception out there is that there's some magic enforcement mechanism that's going to force people to do things against their will.
What was the biggest surprise when you accepted the role as director of the Department of Health and Welfare, Dave?
Well, there were so many. It's a huge department that has 8 divisions that do a diverse set of things. And it covers everything from what here in the U.S. is called Medicaid, which is a state federal partnership for health insurance, through to behavioral health, included obviously public health, which was something relatively new to me. Also included licensing and certification of all the healthcare facilities across the state. The department runs 4 hospitals, 3 psychiatric hospitals and 1 for individuals with developmental disabilities. Also oversees the child welfare program, and the list goes on. So there are many surprises, but probably the biggest surprise for me came a year in when nobody told me there was going to be a pandemic in the middle of my time as director of health and welfare.
That was a pretty quick situation. You took the role, and suddenly we were announcing a pandemic, something that the last couple of generations had never lived through.
Yeah, that's true, and I certainly wasn't expecting that. I thought I was going to be spending my time on other things, and spent a good chunk of my time in that job with the pandemic, as you can imagine. As you said, it had been about 100 years. That it was called the Spanish flu. Actually, wasn't anything related to Spain, but it happened about 100 years previously, about 1918.
Well, you led that department through the most challenging time in recent history. And it was interesting because suddenly health and healthcare became politicized nationally, globally. Was there a tipping point that you could identify where things seemed to change from accepted that it's good for all of us to, gosh, there's a lot of different ways to think about this?
Um, Gosh, I have to think if there was maybe a tipping point. I think for me, probably after about a month or two, because when the pandemic first started, initially everybody had a similar reaction, which was unknown and fear, frankly, of that unknown. And there was a pretty strong desire to collectively take action to try to deal with this thing that was happening. Um, and I don't think any of us expected that it was going to take 2 to 3 years to get through that cycle. And I think after that initial fear subsided, and people started to realize that this wasn't going away in a month. that's when I saw different reactions start to take place. So initially it was this, oh my goodness, what is this? We don't know what's happening. Am I at risk? Is my family at risk? And then once we got through that initial kind of fear, so probably about a month or two in, and people were like, "Well, I'm tired of this. Okay, I can stay at home for 2 weeks, but now it's been a month, and now it's been 2 months." And I think that's when I think things started to change a bit.
There's so many key dynamics during that period of time. Were there important relationships during that period through the centerpiece of the pandemic that you really leaned on? I mean, help us understand a little of the dynamics of what the director had to deal with all of the different constituents in the middle of the COVID-19 pandemic.
Yeah, it's a great question. For internally, I really leaned heavily on the division administrator is the title, but the person who ran the public health division, her name is Elke, and I relied on her quite heavily. And then we're lucky in Idaho; we have a very talented state epidemiologist, Dr. Christine Hahn, and I relied very heavily on her. In addition, the governor and I decided that we would create an advisory council, kind of a panel of experts to help advise us through this pandemic. And I came to rely very heavily on those experts, and they ranged from medical experts to we were fortunate that we had a recently retired expert on infectious disease, and so she was on that and was very helpful. And we had business people on there to help us understand business implications. So that was kind of the group that was the central group that I relied on was that, and then obviously we relied on our federal officials as well for some guidance and insight and research that they were doing. But it was really that advisory council, the governor, and a couple of key staff at the department that we relied on pretty heavily. And then from there, the biggest, the two, I have two lessons from the pandemic, and here they are. One is that viruses are unpredictable, and so no matter how good you think you're going to get at saying what's going to happen next, they are unpredictable. And then the second is people are funny. And so people react and have these interesting reactions to when these catastrophic events happen. Um, and so on the last one, our biggest strategy was really about communicating. And so I often joke with the governor that I think I hold the record for the most press conferences of any director of any agency in the state of Idaho ever, because we had a lot of them. I had over 100 that I did alone, and the governor and I did well over 50. The governor and I did every other week telehealth kind of at town hall with it was through AARP, but it turned out to be open to the public, and many media interviews, and really that was one of our biggest challenges was in the face of a massive uncertainty, like we were learning as we were going, unknown virus, unknown impacts, unknown how we're going to deal with this, it would evolve, those sorts of things, was really communicating with the public was one of our most important goals. And I guess history will determine whether we were good at that or not. But that was really one of our biggest challenges was just the communication aspect.
Recently, I was privileged to hear General Gus Perna, who headed up Operation Warp Speed in the United States, which was the federal government's response to the pandemic. And he had some fascinating perspectives and would love to get yours as well. His thoughts were, yes, things have improved in our ability to respond to this sort of situation, but it's far from as rigorous or disciplined as it needs to be. And he does have concern because it's not an if, it's a when that we would deal with something new, especially with the speed of mutation, all the travel globally, how easily things can move from one place to another. We're seeing that now with bird flu and showing up in dairy cows. So curious about your perspective. Are we in a better spot today? And what are the steps that we could take to be best prepared for the future?
Oh wow, that's a broad question there. So that was one of my. I remember early in the pandemic, getting home late from work, and on it was a Sunday, and I decided I'd go out for a walk to just try to unwind from the craziness of the last month or so. And that was my internal conversation was gosh, we are in the 21st century. We have the most advanced science we've ever had. We have, from communications to internet to research to, medications to scientists, etc. And yet here we are just getting totally, essentially beat by this little tiny virus. And I was just sort of struck by, despite how far we'd come as a people, as a society, as a planet, that still, Mother Nature has these nasty little surprises that even with our best technology, we were caught, really unprepared for. We didn't have something to deal with that virus, a vaccine, for example, those sorts of things. And it was really humbling, frankly, to just realize how how talented Mother Nature is, and how far we had come, but we still were not, and been as prepared to places we could have been for that. Now, having said that, I actually appreciate Operation Warp Speed, because that was the fastest creation of a vaccine that was ever been done in the history of the world, and it was truly amazing. The technology that had been in place for about 20 years, and to get a vaccine within a year was truly amazing. I remember the day the vaccine came out, I just felt this incredible sense of relief that came over me personally, as that first vaccine was administered to a doctor in Rexburg, Idaho. It was the first place in Idaho, and it was truly amazing. But it took a year, right? It took a year, and with all the technology we had, with everything that we have in place to help us be healthy and navigate the modern world, the best tool we had was everybody stay home. And so that was a pretty humbling moment. And so I think I too believe that there will be another pandemic. I don't know when. There'll probably be many more pandemics. I don't know when that'll be. I think we are better each time. We're better and better prepared. We certainly were better prepared than the Spanish flu in 1918. I think saw a miracle happen, and I'm thankful to the general for his efforts in leading that effort of Operation Warp Speed. But I still think we will get caught with our best tool will be wear a mask and stay home. And I think that's part of being on this planet, actually. So I think we'll get faster and faster, but I think it'll still be a reactionary thing.
The general was very complimentary, by the way, about the relationships that he was able to form with governors and people in your position around the nation, and the ability to pick up the phone, talk with someone, get results quickly, and really complimented folks in those roles and their willingness to collaborate and cooperate. So that was a call out on his part about the success of Operation Warp Speed. So
And that was actually, sorry to interrupt you, Dave, but that was actually one of the highlights to me of the pandemic. So I've kind of put on some negatives here, but let me give you a highlight, which is, wow, in times of crisis, I'm always, and there are always some detractors, but I was more amazed by watching people come together to make something magic happen. And the governor and I sat in over 50 phone calls with the White House, and the federal staff, Zoom calls through that time, and the level of non-politics and collaboration that occurred in those calls was truly stunning. And just watching whatever every state was trying to help each other out, share what they knew. Our federal partners were working so hard to share everything that they knew, and that level of collaboration was truly stunning. And I can't tell you the number of calls that I got, or emails, mostly emails, from people trying to identify ways to help. Whether it was church groups that would email and say, "Hey, as our project this week, we're making masks and trying to get them to hospitals who needs them," or people that were trying to put together services before as grocery delivery took place. We had seniors that couldn't get access to groceries, and people that were just organizing neighborhood drives to say, "How do we get food on people's doorsteps," kind of thing. So that was actually one of the best parts of the pandemic, was that level of from a grassroots level, people in neighborhoods all the way to the federal level saying, how do we help people right now, and how do we solve this? So that was actually a fun thing to watch.
really showing the best of who we can be.
Exactly.
Well, let's jump off the pandemic train for just a second and
Thank you.
talk about there may be a little post-traumatic stress disorder for you and others that were in the big chair during that period of time. Um, Can you highlight some of the top challenges for public health from your perspective? And have these changed over the last 5 years, setting aside the pandemic, just the speed of change in society and the different things that we're dealing with in the economy, and certainly in healthcare? Any thoughts on that?
Yeah, let me tell you what I think in Idaho anyway, the biggest public health challenges are, and then I kind of talk about if those are new or different. And we actually spent quite a bit of time working with a cross-functional group across Idaho to identify um, what the top public health priorities were for the state. And here's just I won't give you the list, but I'll just give you a couple flavors of them. So one is actually tobacco usage. So that's a public health risk that's or issue that's on the list. One is obesity. So that's a public health issue that was on the list. One was behavioral health, which is a rising issue, and we see more and more behavioral health needs across the state. And then, interestingly enough, in Idaho, um, uh, the public health risk that we see is it was got classified as accidental or unintentional death, and wrapped in there is actually suicide. But also, in that Idaho is a very agricultural state, and we have a high number of uh, particularly either recreational or agricultural deaths that um, are very unfortunate and premature for those individuals. And so those are probably the top health risks that we saw. One is around tobacco, and one is around and then the last one that I'll mention there is really around just vaccination. Idaho has a very low vaccination rate, and so there's a lot of effort to improve that. Have we seen those change over time? Tobacco usage, no, that's been around for a while. The obesity one has grown over the last 30 years, so it's not new, but it's different than it was 50 years ago. Behavioral health, we've seen that increase a tremendous amount. And unfortunately, we've seen the suicide rate in the state increase far more than it should.
Is there a future for Medicaid? When you touched on it earlier, I think most folks are aware of the difference between Medicare and Medicaid. And there is an intersection there as well with the dual eligibles. But the future for Medicaid seems to be in constant flux because it is so heavily dependent on the federal government for funding. But then each state has a role to play too. So, what are Dave Jeppesen's thoughts about Medicaid, not just in the state of Idaho, but nationally? Does it have a future?
You know, I think the short answer to that is yes. Um, the Medicaid, having overseen the Medicaid program for 5 years, and there was actually a division administrator directly running that. It's a difficult place politically because there are two pressures that are polar opposites politically on Medicaid, and they tug and pull at each other. And one pressure is please control the cost of Medicaid. So in Idaho, the single biggest state expense item, and I'm including the federal dollars to say that is Medicaid. So the Medicaid budget for this coming year is $4.5 billion for Idaho, and that's the single biggest line item. Most of that is federal dollars, um, as opposed to state dollars, but it's the biggest one. And so there's a very strong pressure politically, and particularly in a state that's more red than blue, to contain that cost. But even in a blue state, there's pressure on those to contain the cost. At the same time, there's political pressure to say, but make sure that all of the providers are paid well enough, and make sure that all the people that need coverage get coverage. And so you simultaneously, it was a very interesting place because I'd have the same legislators say to me, control the cost of Medicaid, but make sure that fill in the blank provider gets a pay raise this year. And I would sit there and think, I don't know how to reconcile that. so, and so I think that's the challenge of Medicaid is it gets caught in the larger picture of how do we control medical costs across the country, but also make sure we have good outcomes and a viable economic model for medical systems. So that larger picture of medical needs in the country, Medicaid is a really sharp and clear focus microcosm of that, and that's how I describe it. So, is there a future for it? Yes. I do not know. I'll be surprised if it continues. I would suspect that there will be changes that happen over the next 10 years, 20 years. to address how Medicaid becomes viable long term. And let me just draw it out. When I started 5 years ago, Medicaid in the state was 3.5 billion, and when I left, it was 4.5 billion. So it went up $1 billion. Now there was Medicaid expansion that took place in there, and a few other things that drove that. But it's safe to say that that's rising quickly. Now, what I used to tell my legislative friends is the state portion of that only rose 3% a year for those 5 years. The rest was all federal. But from a big picture perspective, it's still growing, and that's probably unsustainable. So I think how it'll look in the future is different, but do I think there's a future for it? Yes, I do think there's a future for it.
Would it be fair to say that the opposing priorities or these dynamics of make sure people are reimbursed and keep the cost down, that those two dynamics continue to be opposing forces? Is that a fair estimation of how you see the future?
Yes, absolutely. I think that's the trigger. And so, what I used to in Idaho, the Medicaid program is understaffed. It only has about 200 people. If you were to look at any health plan of similar size, if you look at a health plan that's a $5 billion health plan, it would have probably 1,500 to 2,000 people that work there. You don't need sales and marketing because that's not part of Medicaid, so they take that out. So maybe you need 1,000, 1,500 people. Medicaid in Idaho has 200 people. And so I think in Idaho specifically, that the choice that the legislature is going to have to make is, do you want to staff up Medicaid to the staffing level it needs to be to actually manage the program appropriately? Because right now it's understaffed, and so that's not managed the way it should be. Or do you want to contract that out? Do you want to instead of Medicaid being the one that runs the program, do you contract that out with managed care organizations or health insurance companies or whoever, or physicians or provider groups or whoever it is that the state wants to contract it out to, and then Medicaid uses their 200 people to be really policy and contract oversight. And I think that's the big decision that most states have to make. Certainly, that's a decision that Idaho is going to have to make. And so that's, I think, one of the big short-term things that'll have to get sorted out, because you have to have the right infrastructure to manage the program correctly. And so, as I used to tell my legislative friends, I have a $4.5 billion budget, and I have 2 financial analysts. That does not feel like that's adequate. I have 1 pharmacist. That is not going to make sure the program is successful. Where most, if you were a health plan or a provider organization, you're going to have 50 analysts that are managing the cost of your structure. So that's a big deal in Idaho that's going to need to be crossed. And most states have dealt with that in one way or another. Not all states, but most states have wrestled with that question.
Some of the more rural states seem to be having a debate about the wisdom of managing Medicaid. And I think you mentioned by outsourcing it or working with a vendor, a debate between managing Medicaid and really just leaving it as a fee-for-service function of healthcare and the state budget. What's your perspective?
Well, um, it's a good question, actually. And you're going to get Dave Jeppesen's bias here, so I'll share that here. Is I think generally I'm a fan of managed care, and that is that there is that force is managed that we talked about earlier versus quality versus cost and experience, all those sorts of things. But I have an exception for that, which is the rural, which is because in Idaho there's I think 30. Dave, you may know better than I do. Critical access. I think that's high. There's a number of critical access hospitals, and they don't make it. If you just went to a managed care model, they're not going to make that. And so I think you have to do something different, whether that's a set fee schedule or a minimum payment that you make to a critical access hospital, or an increased fee for service schedules to keep them viable. Because the data is pretty clear that if you lose your critical access hospital, and I'll pick an Idaho town in Arco, Idaho, which is an isolated part of Idaho, the health of that population is going to diminish quickly. Arco, the next closest medical facility to Arco, is a 4-hour drive. And if you lose your critical access hospital, and your pharmacy, the health of that community is going to suffer. So I think there is a bifurcation, which is For general population, I think managed care is the way to go. And then for rural, I do not know what the answer is for rural, other than you probably have to uh, prop that up to make sure it remains viable.
Certainly a difficult decision for mostly Western states, but rural states writ large to struggle with going
Yeah.
forward. So, Dave, why don't we give you the crystal ball moment here, and if you would gaze into your crystal ball and share your thoughts on the future and prediction for the roles of government and the healthcare community in public health.
Um, yeah. So let's see, public health lens. Let's start with government. I think government fills an important role that would not get filled in public health otherwise. And there are a number of efforts and focus that don't have an ROI in the business world, but have an important ROI for society. And I think that's where the government steps in, and that has an important role. And that's things like developing vaccines, right? There's no money in vaccines. But if you have a government function is to help make that happen. And we have an interesting mechanism of how we do that here in Idaho, for example. Um, and obesity, right, is a very much a long-term program, and certainly those that are in the private sector have a focus on that because it affects people's health and whatnot. But I think government has a unique position to spend money on advertising or tools or things like that. So in Idaho, for example, we have a very robust program for cessation of tobacco usage. And it's an ROI negative, but it's a societal good, and that's I think where government steps in. So I think there is a role for government in public health, and there's a cadre of passionate professionals that focus on that every day. I give you an example of that. So in Idaho, there's only one animal that's the original source for rabies. That's bats, actually. So if you ever run into a bat in Idaho, and you need to go see a doctor right away, because that is where all rabies in Idaho originates from bats. So if you get rabies from a dog or a cat or some other animal, it's because they got bit by a bat. Um, and uh, and that's a public health function to educate the public on rabies comes from bats and what to do if you run into a bat and all those sorts of things. So there is this function for government, I think, in public health that's really, really, really important. And then on the private sector side, that's been talked about for a long time. But a true population health approach is ultimately what's going to be the best business model for the private sector. And it's patient involvement and long-term focus, and what's the long-term drivers and short-term drivers, and how do you engage people, and all those sorts of things. And it seems very similar to the public health side, but it is different because they're actually administering healthcare. And in most healthcare is reactionary, at least in the U.S. And I think the shift towards population health in the private sector will really push upstream to preventative healthcare measures. And as the further upstream that population health goes, the more and more it'll merge with public health that government does, and it'll get closer and closer. But I think that's the real future. And there's lots of vehicles to get there. We've talked about a couple, a managed care model and then a capitated model and all those sorts of things. Help you get there. But the ultimate thing I see the private sector doing is heading towards a true population health model. And as that progresses, and as the government progresses, they'll actually merge closer and closer together and to be very in a similar space, which is ultimately all the way upstream of preventative healthcare and helping people own their own health outcomes.
Well, Dave, thank you so much for joining us. It's been a real privilege to have you share your thoughts. When we handed you the megaphone, you shared some things that I'm sure people will take away and think about themselves. And coming from someone with your depth of experience, it was extremely valuable to have you share those perspectives. So thank you so very much. For more about Medvale, visit medvale.com for a deeper dive into the Medvale community and the different resources available. Join us next time for Megaphone from Medvale Media. I'm Dave Self. Be well.